Hi, everybody. Thank you for joining us today. We apologize for the delay in getting started, living in this post-COVID world and still having technical difficulties across all four of us. So thank you so much for joining. I am Tracy Wise. I am the Senior Vice President for Business Operations and Administration here at the Center for Health Affairs. We at the Center are really proud to present our Healthcare Leadership Series on our Bright Talk channel. For the past over 100 years now, we have been serving Northeast Ohio and our hospital members across the region, as well as all of our members across the country, to look to healthcare experts who are setting the path forward in improving health outcomes in the communities we each serve and meet everyone where they are. So we're really thankful to be joined today by our guest. Today, I'm joined by Dr. Robert Needleman from MetroHealth and Katie Feldman and Jennifer Kinsley Smith, both who are attorneys from the Legal Aid Society of Cleveland. Before we get started, I want to remind the audience that we're live, as you've seen, even through our difficulties, and interactive. We want to hear your questions and feedback, so please submit your questions through the player at any time, and we'll talk through them throughout today's discussion. So let's get started. I'm going to first ask our three panelists to introduce themselves and provide some background on medical legal partnerships, which is what we're here to talk about today. Katie, let's start with you. Can you give us a description of legal aid and the civil legal services? What is MLP and about what your work here is in Cleveland and nationally?
Yes, great. Thank you so much, Tracy, and good morning. With the Legal Aid Society of Cleveland, as Tracy mentioned. At Legal Aid, I manage our Health and Opportunity Practice Group, which consists of our public benefits, education, and immigration law practices. The group also includes our medical legal partnerships with MetroHealth, St. Vincent Charity Medical Center, and the UH Rainbow Center for Women and Children. For those of you who aren't familiar with Legal Aid, we're a nonprofit law firm whose mission is to secure justice and resolve fundamental problems for those who are low income and vulnerable by providing high quality legal services. These fundamental problems include all types of civil legal needs that impact the client's shelter, safety, income, or access to the justice system. For example, we represent clients in their eviction proceeding, or to get a civil protection order against an abusive partner, or to seal a criminal record that has created a barrier to finding employment. Cleveland Legal Aid covers a 5-county service area here in Northeast Ohio, which includes Cuyahoga, Lorain, Lake, Geauga, and Ashtabula counties. We were formed in 1905, which makes us the 5th oldest legal aid organization in the country. To qualify for our services, our clients must have a household income of less than 200% of the federal poverty guidelines. This means our income eligibility caps at about $25,000 for a household consisting of one person and $53,000 for a household of 4 people. Our services are completely free, but the need for legal aid help always far exceeds the resources we have to address that need. A 2017 report from the Legal Services Corporation shows this justice gap pretty dramatically. 71% of low-income households experienced at least one civil legal problem in the year leading up to this report, including problems with healthcare, housing conditions, disability access, veterans benefits, and domestic violence, among others. 86% of those civil legal problems in that year received inadequate or no legal help. One way, though, for legal aids to leverage our work and impact more people is through partnerships. In Cleveland, that means a medical legal partnership program has been one of our longest running and most effective partnerships. The National Center for MLP describes MLP as programs that integrate the unique expertise of lawyers into healthcare settings to help clinicians, case managers, and social workers address structural problems at the root of so many health inequities. You may have noticed that many of the civil legal issues I mentioned, like housing and protection from domestic violence, impact a person's health. The goal of the MLP programs is to integrate legal services into the healthcare setting in order to address social determinants of health and the health-harming legal need. While our clinician partners can address the health issue presented in the exam room, MLPs add legal services as another tool in their toolbox to address the same issue. Here in Cleveland, Legal Aid partners with the 3 healthcare institutions I mentioned above. We've partnered with the MetroHealth System for 18 years and with St. Vincent Charity Medical Center and the Rainbow Center for Women and Children for about 3 years each. Each MLP site focuses on a particular patient population. Within MetroHealth, we have MLP staff focused on pediatrics, seniors, and a community health center that serves a large immigrant population. At St. Vincent, the MLP focuses on adult behavioral health patients and those being treated for substance use disorders. And the MLP housed at the Rainbow Center focuses on women and children. When we're not in the midst of a pandemic, our MLP staff split their time between the legal aid office and their office on site at their healthcare partner. There are also MLPs all over the state of Ohio now who partner with other legal service providers. We meet quarterly as a statewide MLP task force to discuss common issues and share practical tips. And nationally, there are over 300 MLP programs in operation currently. There's a National Center for Medical Legal Partnership that's housed at the Milken Institute School of Public Health at George Washington University. And the National Center provides technical assistance, consultation, and research for all of us. So now I will pass this on to our co-presenter, Dr. Robert Needleman from MetroHealth, who will introduce himself and tell you a little bit about his journey with MLP.
Good morning. It's great to be here. Thank you for that really informative prelim. I'm a pediatrician at MetroHealth. I've been at MetroHealth for about 20 years, and before that, I was a pediatrician at Rainbow Babies and Children's. And before that, I was a pediatrician at Boston University, which was the original site for the first medical legal partnership, which was in pediatrics. And so my journey goes way back to the beginning of my career. And the idea of the medical legal partnership, which came out of a holistic vision of child health that recognized that what makes children healthy or not healthy often is much bigger than what comes typically into the exam room with children. My first experience with the medical legal partnership was going on a home visit to a child who had very severe asthma and realizing that the child was living in a mold-infested basement with a window that looked out onto a busy street. I was feeling asthmatic the minute I walked into that home. And through our collaboration with Medical Legal Partnership, we were able to find a much more secure and less toxic environment for that child and family to live in. And not surprisingly, emergency room visits for asthma dropped sharply and the child did much better. So my perspective on medical legal partnerships is principally through the lens of pediatrics. My role at MetroHealth Medical Center is the division chief for developmental and behavioral pediatrics. And in that role, I see lots of children with mental health needs, learning needs, behavioral needs. And these are some of the most involved, most in need of medical legal services. So I think of the doctors at MetroHealth, I'm probably one of the heaviest users of the service and have been for many years, both because I think it's incredibly important and also because the patients that I serve really are impacted greatly by those systems. Just a word about MetroHealth. As you know, we're the smallest of 3 medical systems here in Cuyahoga County. We see ourselves as being special in the sense that we focus on the needs of the least empowered patients and try to treat them in the most positive and possible richest way that we possibly can. Those of us who work at Metro feel very strongly that our mission is to provide superb medical care to everybody who walks in the door. And in particular in pediatrics, we have a crew of highly trained pediatricians joined by a very creative and exciting group of young doctors, both in medicine and pediatrics, who have worked with our patients. The other thing that's rather special about us is we have an extremely diverse patient population who bring to our door lots and lots of needs that are addressed well through the medical legal partnership. And we have a particularly excellent medical legal partner in Jessica Backlini, a legal aid lawyer who works closely with us all the time. I think with that, I'll stop and turn it back to you.
Thank you, Dr. Needleman. I appreciate the overview, very helpful information, and to get to understand the unique population that MetroHealth is serving and how closely it's tied to the mission of the Legal Aid Society. Jennifer, would you be so kind as to introduce yourself as well and the work that you do?
Morning, everyone. My name is Jennifer Kinsley Smith. I'm an attorney with the Legal Aid Society of Cleveland, and I staff our medical legal partnership at St. Vincent Charity Medical Center, which is a faith-based acute care hospital right in the heart of downtown Cleveland. And as Katie mentioned, I serve a adult behavioral health population. A lot of my clients have co-occurring mental health and substance use disorders. But we are open house-wide to all the patients of St. Vincent. So that includes a bariatric center of excellence, a spine and orthopedic institute, primary care, behavioral health, addiction medicine, the psychiatric emergency department, and emergency medicine. It's also a teaching hospital with residents, fellows, and students. But the St. Vincent Charity Medical Center serves the heart of Cleveland Central community. And so we do serve a patient population with very intense social needs in addition to their medical needs. And so as a result of a community needs assessment in 2017, in October of 2017, we launched the medical legal partnership between St. Vincent Charity Medical Center and the Legal Aid Society of Cleveland. And since that time, we have received many, many referrals from our shared patient clients. And I just wanted to address the most common issues that come up through our medical legal partnership to give an idea of the issues that these patient clients are facing. The number one issue we see is income support. So patients who have seen their food stamps terminated, have seen their SSI benefits stopped, and they don't understand why. Housing conditions issues like Dr. Needleman mentioned, mold, pests. We've had patients who have no door or a door that doesn't lock. Criminal record sealing inquiries, both to address employment, like Katie mentioned, but also housing. A lot of individuals have barriers to housing because of their criminal records. And finally, family issues, so custody, or divorce, especially to seek safety, as Katie mentioned. So most of the issues we see are really highlighting individuals trying to reintegrate into life after an extended period of mental illness or substance use that they now are working with a doctor to control and would like to help balance out the rest of their health.
Thank you, Jennifer, and thank you all. Welcome again. I'm going to start off with you, Dr. Needleman, if you don't mind. Can you tell us, how do you as a physician identify a legal issue and make an MLP referral? Oh, and I think, hold on, let me unmute you. There we go.
There you go, yeah. Sure. So very often the patient will come out and actually announce that they have certain needs, and then it's just a matter of drawing the connection. So we hear about children who are struggling in school, and we've been well trained by our medical legal partner to then inquire about special education supports and where in the process of obtaining special education supports they are. So that's something that is part of the standard screening that we do for children. And then when we find a child who's struggling, to find out whether special education supports are in place. And very often we find that a parent is frustrated in their attempts to get the supports that they need for their child. So that's one of the things that comes up very, very often. We screen parents and children for safety in the home. And when we hear about safety concerns, the next question often is to identify what supports a parent has. And then frequently that will lead to a referral for the medical legal partnership. And then with our special needs kids, who are a very large percentage of our population, we'll be screening routinely for support. So we want to know if they're receiving benefits from SSI, for example. And a simple question leads to the either identifying a need for support or not. So it really comes out of the clinical history.
Very good. Thank you very much. It's a field that I was not very familiar with until I had a chance to meet you all, and to understand the nuances of how someone can navigate through different systems is obviously really critical. So, Jen, from your perspective as a lawyer, what is then expected the workflow for a typical MLP case? How does that work on your end?
Yeah, so like Dr. Needleman mentioned, the first step is extensive training. So legal aid comes into the medical provider and provides training so that they know what to look for. And we always say, you diagnose the medical part, let us diagnose the legal part. So if something doesn't sound right, it's probably worth us looking into. We do provide little tips like what a food stamp award should be, so that if a patient says, oh yeah, I get $36 in food assistance, a provider would know that something's wrong to make a referral. So the first step is education. The next step is issue spotting, like Dr. Needleman said again. Sometimes it comes out. Sometimes it's caught through a screening tool. Sometimes we at St. Vincent encourage providers to just say, we have free legal services here on site. Would you like to be connected with them? Because sometimes patients are worried about stigma, or don't really want to disclose to their doctor what it is that's going on. We've had referrals come through that way. But what happens is the provider makes a referral, and there's different nuances to the referral systems at each of our programs. But it might come through the medical record, it might be a fax or an email or a phone call. But essentially, we receive a referral for the patient from the provider. And then we do a quick intake process with the individual to make sure that they meet our income requirements that Katie mentioned earlier. And at some MLPs, maybe all of them, we do what's called a legal checkup. So they might be referred for a food assistance issue, but we're going to check them for bankruptcy, criminal record sealing, family issues, so on and so forth, to really evaluate their legal health and figure out which cases we need to open and how much service each of those cases is going to require. For example, are we just giving them advice, letting them know, bankruptcy isn't right for you right now? Or are we representing them either in court or for a full administrative hearing? So there's a full range of what kind of service can be provided based on the referral that gets communicated to the client, and we are often running with the legal case. So one of the biggest benefits of the MLP is from referral to case opening is a very quick process for us.
It sounds like you would interact with several people across a healthcare system. So I'm curious, either Jen or Katie, if you could talk to this. How does the MLP's work differ from that of a hospital social worker or a resource navigation program? And in that same context, how do those roles interact between you all and those types of roles within the hospital system?
Yeah, I can start, and then Jen can add on if she has something additional. But they're really two very different specialties. We've had different training, we have different expertise. But the social workers, especially, I think are, the natural referrers. Like there are some great physicians like Dr. Needleman who are spotting these issues, but a lot of his colleagues the first referral they'll make is to social work when they identify a social need. And then the social workers have a number of great resources. And what I say is when you hit a wall, that's when you should start thinking about MLP. If you have helped somebody fill out a SNAP application or Medicaid application, and then they get that denial, that the social worker, just doesn't have the resources or the training to do the appeal hearing, but the MLP lawyer does. So you help the person with their application. If there's a denial and it doesn't make sense, the person's low income, should qualify, get that to the MLP attorney. Or, we might work together on, somebody who's facing a housing eviction, make the referral to the lawyer to represent in the eviction case in court, but the social worker can be working on alternative housing options if the eviction case doesn't go their way. I think we work very well together, and I think it's to the benefit of the patient to have both the legal side and the social work side collaborating to approach it from a couple different angles. And I know Jen at St. Vincent, a lot of the referrals there come through social work, so she might have a different answer for us.
So I do not have a different answer. I would agree with everything Katie said. I actually had, the exact same thought. When the social worker reaches a place where they can't solve the problem anymore, that's usually when we get the referral. My examples are a little different than Katie's because we have a different patient population, but the client needs a group home in order to thrive in the community. The social worker is going to do all the aligning to get that client into the group home, but when the group home realizes the Social Security has been suspended and there's no way to pay the monthly rent for that home, that's when we get involved to identify and address the legal issue. I would say we're absolutely partners. We help each other. I would say, social work also has significant training in working with individuals who have diagnoses that lawyers often don't have. So in addition to supporting the legal work, I think it's important to note they also provide a lot of the medical background or support that we don't have in our training. So it really is just a difference in training that makes us stronger as a team.
That's great. Thank you. As Dr. Needleman said in the beginning, it is really a holistic approach, it sounds like. And so I'm curious, Dr. Needleman, obviously thinking about sort of next generation of doctors, you are clearly the example being set for doctors who can leverage these types of relationships. So how do you incorporate MLP into your pediatrics resident training program? How are you bringing up sort of the next generation to take the torch forward that you've set the example for?
So there are really three ways, and I don't take credit for this. This is really the work of Jessica Becklini, who is so active and effective at Metro with us in pediatrics and in the Med Peds residency. So throughout the year, Jessica gives 7 lectures in the routine course of the residence training. So there are lectures on, this is her list, special ed law, housing, school and discipline issues, immigration and family law, health and other benefits, SSI and survivor benefits. So over the course of each year, the residents hear those lectures. And then there are 2 of our resident rotations, each of them lasting a month in the course of the residency, where the residents have a more intensive interaction. So on the developmental behavioral pediatrics residency month, the residents will accompany Jessica to an IEP meeting, a special education evaluation meeting at the school. This turns out to be a really transformative experience for many of the residents because it gets them out of the hospital. They see how the child is living in their everyday life. They understand how the child interacts with different systems, and they can see how incredibly effective advocacy can be in changing how the school is approaching the child. Very often, although they're there as observers, they'll be called upon to add some detail from the medical record, particularly if they're kids that we've worked on together. And so they become active members of the team. And then during the community health rotation, which normally occurs at the last year of their training, they're also involved in medical legal advocacy, sitting in with Jessica and looking at different institutions within the community that the residents or the patients interact with. The third way that the residents learn from the medical legal partnership is through research. And on any given year, there are usually 1 or 2 groups of residents working with Jessica, often with me, to look at questions of how do we increase referrals, or how do we track outcomes, how do we monitor patients' success in medical legal partnerships and other related issues. So there's an opportunity for the residents who are active in advocacy to really get their feet wet and learn much more.
That's wonderful. Thank you. I'm curious, Jen. Jen, can you hear me okay now?
I can.
There we go. I'll ask the question again in case you didn't hear it or anybody else didn't, because technical difficulty today's on our Tuesday here when we're filming or casting this live. So the question is, how has MLP work changed during the pandemic?
So naturally, our referrals dropped off throughout the pandemic for a multitude of reasons. At our St. Vincent program, the hospital census was just low. In other areas, when you're not having elective surgeries and things like that, there's less people in the hospital. And so we kind of regrouped and identified that the need was really becoming a liaison between the patients, the systems, and the medical providers. So we really took an education role as opposed to the in-depth advocacy role we were doing before the pandemic. And we started focusing on, the CARES Act bills and what social services entities were doing, and regularly communicating with our medical providers. This is the rent assistance that's available in these neighborhoods right now. This is every household's getting the maximum SNAP allotment for this period of time. We communicate a lot about the CDC eviction moratorium, and we're still doing that. We just had a meeting yesterday trying to gather where we're at with that. So we just tried to provide consistent, and still are continuing to provide consistent updates to medical providers about what the legal landscape and the social landscape looks like for their patients, because we know that the pandemic is causing toxic stress in a way that many of these patients have never seen before. And so, they're not buying medication because they're worried about making rent. And so if the physician or provider can leverage, you cannot be evicted for non-payment of rent if you've been impacted by this pandemic because of the CDC moratorium, let me refer you to the MLP. It's an immediate way to address this toxic stress. So we've tried to empower the providers with this information so that people feel more secure or more comfortable in whatever way possible based on the information that we have. That also for our St. Vincent MLP looked like spreading the word when coordinated intake or homeless services changed their way of accessing, because we had a lot of people who didn't know where to go now because things had changed. That was the same for, substance use and, mitigating what they were going through at that time. So we really did what we could to advocate in the community and to advocate with providers about information. We're still continuing to do that, although we are slowly transitioning, and we have been taking referrals from our medical partners, even though we are offsite through the entirety of the pandemic. So none of them, thankfully, had to close or stop throughout this time.
Thank you for that, Jen. If you don't mind me staying with you for just a moment to talk a little bit about the impact on community health. I know you mentioned with St. Vincent's Charity Medical Center that the need arose to look at this program based on some community health needs assessments. So can you address how MLPs are impacting community health, and specifically, how does helping individual clients with their civil legal issues improve the health of the community at large?
Yeah, so I think that happens in a couple of different ways. The most notable way is when we advocate for an individual, we often have the opportunity to advocate for the group that they're a representative of. And so MLPs allow us to identify trends, I would say. So, if if we're serving individuals who are all accessing the same health system, we tend to find out about, apartment buildings that have egregious conditions issues where many members of the community live, or administrative agencies who are not appropriately accommodating individuals with disabilities. And so it allows us to identify issues and represent individuals who, otherwise may not realize they even had a legal issue, and represent them in litigation or advocacy or even just conversation to fix a larger problem that one individual is a representative of. But also, I think it's important to note that when someone has a civil legal issue that's preventing them from safely interacting with the community, our ability to restore their income and restore their access to healthcare allows them to participate in the local economy and to engage in local activities and efforts. And so legal aid often discusses the ripple effect, and I think that the MLP is a great starter to the ripple effect. You help several families throughout an area to understand rent deposit and not tolerate bad conditions issues. They tell their friends contact legal aid, and before you know it, we're getting conditions approved throughout the city. And that could be the same for any legal issue. So I would say systemic advocacy and also empowering the local community and economy is how MLPs help the greater whole.
That's really wonderful perspective on sort of what is the impact to everyone within the community and how this work can help propel the health of the community, as well as obviously within each of your respective systems and work that we all do within the greater Cleveland area, but also across the country where legal aids operate. Dr. Needleman, my question for you then is sort of more on the micro effect here. So for the patient themselves, how do you feel the MLP has both impacted patient outcomes as well as your practice as you continue to practice medicine with pediatric medicine?
So the specific outcomes, of course, depend a little bit on quite a bit on the specific issues. So very often, if the child comes with pulmonary disease, with asthma or allergies, changing conditions, as I've mentioned, really immediately improves their medical condition, cuts down their medication use, cuts down their emergency room use, and cuts down hospitalizations. So that can be a huge game changer. If the issue involves special education advocacy, which is often where I come in, what I get to see is the huge difference in a child's global health and specifically mental health when they go from a situation where they're not receiving adequate services in school, hating school, causing trouble in school, figuring out ways to get out of school because they're so uncomfortable, often being bullied, sometimes engaging in retaliatory bullying. And then, along the lines of the ripple effect, those negative ripples extend to parents who are getting called frequently at work to come pick up a child from school, threatening their employment. And so the inappropriate educational placement for a child can affect the child's health directly, their mental health, not only their education, and then the whole family. And conversely, when things change, I see parents coming back and saying, I worked with Ms. Becklini. We have an IEP now that's working. He's learning well in school. He likes going to school. The phone calls interrupting me at work have stopped. And really dramatic changes in that, and that we see all the time. The changes from connecting children to income supports are also important, but they don't tend to be quite that obvious. But we ask about them, and the child is now receiving SSI benefits, and some of the stress on the family in terms of just financial shortcomings really makes a difference. One of the ways that financial pressures affect children directly is that parents under great financial stress are stressed and exhausted. And so they don't have time to do the sort of normal parenting stuff that kids really need. just time to talk or time to play a board game or time to go for a walk. Parents are grieving because they don't have that time, and the kids are grieving and they're often angry. Sometimes the infusion of income supports results in a parent being able to not have to work that second or third job, and things get dramatically better. Then we hear about parents who are having fun with their kids. One of the main sort of outcomes is, what are you doing that makes you feel happy together? And when parents can answer that question easily, I know that there's a lot going on that's right. When they can't, I know that there's a lot going on that's wrong. And we begin to ask the questions, what's happening? What's blocking this from happening? And very often it's income stresses. And sometimes the answer is to get additional support through the help of our legal partners. One other thing I'll mention in this regard, we'd asked about how it affects our practice. One of the things that we see both as clinicians and then also as teachers to the residents is that we tend to address problems that we have tools to fix. When there's a problem that seems beyond our reach, it's also easy to focus on other things. We do what we know that we can do. Knowing that we have a partner in the medical legal partnership allows us to focus our efforts on those issues because we know that they can get better. So from the standpoint of the mental health of the provider, or sometimes we talk about it in terms of burnout, having a partner who can actually do the things that we know need to be done for a family is a tremendous preventer of burnout for us, because we feel that we have efficacy and we're not hopeless and helpless. But we're in the same boat very often as our patients, except if we can reach out and get help from somebody who's effective, which often is what happens.
It really, I know this terminology is used a lot within medicine, but it really does sound like a very transformational practice that when put into use, can make a world of a difference on, not, as you said, not just burnout for physicians or just for the family, but really, again, back to that whole community. I'd assume, Jen, that there's also a transformation that happens across the health system. So, thinking of St. Vincent for specifically around the work that you do, how has the MLP at St. Vincent developed and evolved as you've learned lessons and in ways that you've been putting this into practice over the years?
Yeah, so when the MLP first opened at St. Vincent, it was a targeted program for the psychiatric emergency department and behavioral health. And now, looking back 3 years later, we are a house-wide program. We also serve Joseph's Home, which is also a ministry of the Sisters of St. Augustine, but it's a medical respite facility for homeless men. And so, what was happening was providers like in the Psych ED are saying, people are coming in here and the entire episode was triggered by an eviction notice that they didn't understand. They think they're going to lose all their property. They bring us in, we talk, everything kind of calms down a little bit. So word was spreading to providers, and providers in other departments wanted to have the tool. And similar to what Dr. Needleman was just saying, they wanted the tool because then when the issue comes up, they are able to utilize it. So the program grew rapidly. We trained rapidly, increased the number of referrers. We also started with a housing attorney, and the intention behind that was also based on the needs assessment. Providers at the hospital said the number one issue that they were seeing was related to housing. We added kind of a public benefits focus, and we had 2 attorneys for a while. And then when the pandemic started, we actually transitioned to me as a public benefits attorney and then a paralegal, because we saw the need transition to more social support focus as opposed to some of the other needs. So we changed the structure of the program. So my paralegal is able to really support individuals with their social needs, helping to connect them to services and maybe staying on the phone longer or engaging with the patient clients longer than I would be able to, or any attorney would be able to on any given day. So we have changed the structure of the program. We've changed the way the program works. And also at St. Vincent, we realized the transient nature of the population. So at many MLPs, the patient is supposed to call the MLP for service, At St. Vincent, we call the patient. So the provider says there's an issue here, the patient consents, and we call them, we track them down, we set up appointments with them because that seems to meet them where they are, whereas other MLPs, that might not be the case. So we really just continue to fluctuate to meet the needs of the patients of the partner.
Thank you for that so much. Katie, I have two final questions that I'd like to pose to you. And so they're sort of two-part here. One is, what are the hurdles? I mean, this all sounds like really great work, and I'm sure it's not through a lot of blood, sweat, and tears to overcome some barriers that might occur. So if you could talk to the hurdles that you have to overcome in order to implement MLP, and then finally, give us some, what would you like to the audience to know to learn more about Legal Aid Society's work or MLPs at large, and what should they know where they should go to find more information?
Yeah, so I'd say really one of the most important, if not the most important factors in the success of implementing an MLP is finding the right partner. Working with a healthcare provider, a site that sees their medical practice in the way that Dr. Needleman described as this holistic practice, and trying to address their patients' needs beyond, as we keep talking about, beyond the exam room, beyond what's happening in that 15-minute, 20-minute doctor's visits, and connecting their patients with the resources that they need for all these other factors that are impacting their health. So finding that partner and not just having one Dr. Needleman, but a group of them that all see their healthcare practice, their medical practice oriented in that way is really, I think, like I said, the most important factor to the success of an MLP. Beyond that, there's some real kind of like nuts and bolts. Funding is obviously very important. I would say one of the keys to the success and the longevity of our MLP with MetroHealth, which, like I said, is going on 18 years now, has really been a shared responsibility between MetroHealth and Legal Aid to figure out the funding and the sustainable funding for this program. Some MLPs around the country pop up for a year or two when they have funding and then go away for a few years and come back when they have funding again. And it's really been a major success, a major victory that we have these continuously running MLPs. And like I said, the shared responsibility, the collaboration between the development offices at the healthcare institution and Legal Aid. And finally, administration buy-in or institutional buy-in from the healthcare partner administration. All of our staff have offices on site, which is not always an easy thing. At Legal Aid, we don't think twice about office space, but at hospitals and other medical institutions, other medical office buildings, just even having that office space, having access to a printer and a scanner and having a place to meet with clients can be difficult. That's a challenge in some places. And so to have the administrative support that we need from hospital administrators on down is really helpful. And then for the second part of your question about learning more, I direct you to two different websites. So the Legal Aid Society of Cleveland obviously has a website where we have a lot of good information about different legal issues, the things that Jen and I have both discussed in terms of like the CDC's eviction moratorium. We have information about that on our website, including the actual declaration that people can fill out if they need to avail themselves of that moratorium at the moment. And there's information, brochures that can be ordered. So if an office would like to know more about the special education rights that Dr. Needleman was talking about, we have special education brochures that organizations can order, and we can send a pile of to share with the clients and patients that you serve. The other websites that I want to highlight is the National Center for Medical Legal Partnership, which I've referenced a couple of times. But they do research on the efficacy of MLP programs. They have MLP toolkit to get an MLP up and running. They do a number of training events, and all of that information is on their website. In addition, there is a place to sign up to receive their bi-weekly email newsletter with MLP updates and events. So those are two great places to get started to both learn about civil legal issues and the kind of status, the universe of the MLP world nationally.
I appreciate that, Katie, as I'm sure everyone who is attending our talk today or who will in the future, because of course this will be available on demand at any time, because it is obviously a very rich subject with a lot of information. I did share the 2 links as announcements here, but we'll also be following up with you as audience members to make sure that if you would like to connect and find out any additional information from either Legal Aid Society or the great work that Dr. Needleman's doing at Metro, or that Katie and Jennifer are working on over at St. Vincent, we'd be happy to make that connection for you. So with that, I'd like to thank you all for joining us today. And thank you to you, Katie and Dr. Needleman and Jen, for sharing your perspective and insights. If you would like more information from us at the Center for Health Affairs or to talk with one of our guests, as I said, you can leave a comment in the chat or connect with us via email or phone afterwards. I'd be happy to connect you to one of our experts. Lastly, we would really love your feedback on today's episode, and not our technical issues, but you can certainly share that too. Those were somewhat user error on at least my part, and suggestions for what you'd like to hear about in the future episodes on the series. We have a ratings feature. We want to be able to provide you with the content through our healthcare leadership series. And if there's more information to be shared or called upon for the Legal Aid Society or the medical legal partnerships, we'd be happy to share that with all of you. Thank you again to my guests, and thank you to everybody. Have a wonderful day.
Thanks.
Bye.